Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, right. So, in the systemic lupus erythematosus, there is a entity called as drug-induced SLE. In drug-induced SLE, actually, the drugs which are responsible for drug-induced SLE are drugs which are responsible for drug-induced SLE can be given by the mnemonic SHIP. SHIP for S for sulfonamides, H for hydralazine, I for isoniazid, P for procainamide are the drugs which can cause SLE. Then, what are the features? In drug induced SLE, the patient will have antihistone antibodies are positive in the patient. Antihistone antibodies are positive. Anti double stranded DNA are usually absent. Anti double stranded DNA are usually absent. Renal involvement is not a common feature, is not very uncommon. Sorry, it is not a feature. Renal involvement is not seen in drug induced SLE. Then there is polycirrhosis is one of the feature of SLE. Skin rash is very common in drug induced SLE. Antihistone antibodies are positive, and these features mainly occur on discontinuation of the drug. If the drug is discontinued, then the patient will develop these features. What are the features? The patient will mainly have polycirrhosis and skin rash is seen without much of the renal involvement. So this is drug induced SLE.
thank you and thank you for watching.